Welcome to Caring for People with Dementia, a primary care partnership. This is Lesson 5, More Than Meds. The experience of dementia is more than medical. It affects every aspect of the lives of people with dementia and their care partners. Geriatrician Al Power developed an experiential, person-centered definition of dementia. Dementia is a shift in the way a person experiences the world around her or him. People with dementia experience many challenges in their day-to-day living. The experiential model of dementia has us look at these challenges from the perspectives of people with dementia so we can better understand how they're making sense of the world around them and we can better support them in a way that promotes overall well-being. One aspect of living with dementia that commonly challenges people with dementia and their care partners is what are often referred to as behaviors or BPSD, behavioral or psychological symptoms of dementia. For the sake of this lesson, we will refer to them instead as behavioral expressions, to emphasize the understanding and treatment of behaviors as a form of communication and expression of need. BPSD is defined medically as agitation, anxiety, elation, irritability, depression, apathy, disinhibition, delusions, hallucinations, sleep changes, appetite changes, and aberrant motor behavior. Because these behavioral expressions have been mostly considered from a medical lens, off-label atypical antipsychotics have been used to manage the behaviors of people with dementia at very high rates. Reductions in the use of antipsychotics to treat behavioral expressions in people with dementia has strongly been encouraged by CMS, the American Psychiatric Association, the American Medical Association, AMDA, and the American Geriatric Society. Reduction efforts have been based on the following concerns. Antipsychotics are not approved by the FDA for the treatment of behavioral symptoms of people with dementia. Antipsychotics carry risks to people with dementia, including increased risk of death. Antipsychotics have shown little or no benefit for people with dementia and only for some people. Their use generally produces a sedating effect, which can also result in a host of secondary risks. Lastly, behavioral expressions are more than medical. There are many possible reasons behind the expressions of a person with dementia that might explain why they are acting that way. The person-centered experiential model focuses more on the reasons behind these expressions so that we can better understand them and find ways to respond to them in ways that meet people's needs. Although care partners might assume that medication can help with these expressions, providers play an important role in helping care partners see behavioral expressions as forms of communication and expressions of need. This quick video gives an example of the person-centered experiential approach to behavioral expressions that is more than medical.
I'm at my wit's end with Dad.
So tell me what's going on.
He's angry all the time. This morning, I was trying to help him get dressed. He got so mad. It's just not even like him. There's got to be some kind of medication to keep him from getting angry, though, right?
Let's talk some options through. Now, I know you want what's best for your dad, and I think we can work through some ways to help you too. The first step is that we have to try to understand what your dad is telling us when he is getting angry. If we can understand the possible reasons behind why he is getting angry, we can maybe address those reasons. Maybe you have heard people say before, behavior is a form of communication. So let's take the situation that happened this morning and quickly brainstorm all sorts of reasons why your dad could have been getting angry. From my perspective, this is a really important conversation because I want to check him out to see if there are any medical reasons or reactions to medications that could be causing him to act angry. Like, for example, if he is in pain.
Wouldn't he just tell me he's in pain?
Not necessarily. He probably doesn't have the right words to communicate that, so he might get angry instead. When he gets angry like this, it might be helpful to think about what is happening before he gets angry and to try to put yourself in his shoes and see what is going through his mind.
Well, I was helping him with his shirt. First, he wanted to wear the shirt that he wore yesterday, and I told him he couldn't. We argued back and forth, but he would not back down.
So, the situation was upsetting him, and he was communicating this to you. Now, maybe not in the best way, but maybe in the only way he could at that moment. I mean, your dad's brain is working differently. So he can't change that. So we have to be the ones that change the way we approach him.
Like letting him wear the shirt?
Maybe. Or maybe think of ways to not have the shirt available. If the shirt is wet, he can't wear it, right?
I guess I just have to pick my battles.
If it is not a matter of health or safety, maybe you have to let things go sometimes. Another thing to think about is that behavior is also an expression of an unmet need.
What type of need? I try to do everything for him.
Maybe your dad misses doing things for himself. Maybe he has a need to have a little more control. It's hard to have someone do everything for you. Maybe he has a need for independence, to do some things on his own, even if they are not perfect.
I always stop him from buttoning his shirt because he's doing it wrong.
Maybe it is okay if his shirt is not buttoned properly. Maybe you can fix it when he's distracted, or even have shirts that he can put on by himself.
So the bottom line is, I need to be a bit of a detective and try to find out where that anger is coming from, and maybe change how I'm acting.
Possible reasons behind the behavioral expressions of people with dementia include health and medical reasons, including medication side effects and comorbid conditions. Communication, including challenges that people with dementia experience in communicating to others, as well as their reactions to others' communication and approach. Possible reasons could include reactions to the task at hand, particularly if it is unwanted, unpleasant, or personal. The environment, including everything that is around a person with dementia that might cause them distress. Unmet needs, including daily personal needs like needing to use the bathroom, but also unmet emotional needs like a need for purpose or autonomy. Life story, which includes explanations for why a person is acting that way based on their personality and their past. In addition, it's helpful for care partners to notice when behavioral expressions are happening, where, who is involved, and what could be triggering these expressions. By brainstorming the meaning behind behavioral expressions, care partners can prevent or lessen undesirable expressions by responding to what people with dementia are communicating or expressing as a need. In your role as medical provider, you can promote a person-centered experiential approach that is more than medical and ultimately enhances well-being for people with dementia and their care partners.
Just keep thinking that this person have a heart, have a mind, have a body, and have a soul. That's the most, I believe. I know it's may sound crazy, but I believe that is the best that we can approach our patient and the family members.
As you look for opportunities to apply what you've learned, consider trying one of these micro steps. Look for the reasons behind the behavioral expressions of a person with dementia to better understand what they are communicating. Walk a care partner through the possible reasons behind the patient's behavioral expressions. Embrace another perspective. Persons with dementia expressing anger when they are feeling they're not being listened to is a normal human expression and something we can address or avoid. Expressing agitation isn't a medical symptom or because of their dementia. Or come up with your own microstep. Each microstep moves you forward to a primary care partnership with your patients with dementia.